This is a very strong start. Thank you very much for coming in spite of the bad weather. I'll give a few minutes about some diabetes news 2019. And the American Diabetes Association started the news in 2019 with this statement that diabetes is a complex chronic illness requiring continuous medical care with multifactorial comorbidities, multifactorial risk reduction for diabetic patients. The patient self-management is very important. Education support, all education support should be given to the diabetic patients. And according to the International Diabetes Federation, diabetic patients were tripled between 2000 and 2017, and this is a major problem. And countries in the Middle East with the highest prevalence are Saudi Arabia with 17.7% prevalence of diabetes above the age of 20, followed by Egypt and Emirates with 17.3% prevalence above the age of 20. And the countries with the largest number are Egypt with more than 8 million diabetic persons, followed by Pakistan, 7.5 million, and Iran, 5 million. Why are these increased numbers? Because during the past 20 years, major socio-demographic changes happened. Life expectancy has been improving, and urbanization and per capita income has increased. These changes led to decreased physical activity and increased caloric intake, leading to increased incidence of obesity and consequently diabetes. Why do we need an aggressive treatment strategy? Because at diagnosis of type 2 diabetes, 50% of the patients are already having complications, and the current management, in spite of very new medications, we are having 2/3 of diabetic patients, they are not controlled. And also in the beginning of 2019, the American Diabetes Association put some recommendation to screen for type 2 diabetes. When to screen in asymptomatic patients, in patients with increased body weight, overweight, or obese persons, when having other risk factors like first-degree relatives with diabetes, like hypertension, hyperlipidemia, history of gestational diabetes, history of polycystic ovary syndrome, history of newborn of 4 kilograms or more, and physical inactivity. And also, there was a new classification in 2019 by the American Diabetes Association. Now there are 4 types of diabetes: type 1 diabetes due to autoimmune beta cell destruction and insulin deficiency, whether absolute or partial insulin deficiency, and type 2 diabetes with progressive loss of beta cell function together with insulin resistance, gestational diabetes, and some specific types of diabetes like monogenic diabetes and diabetes related to cystic fibrosis of the pancreas. And the immune-mediated diabetes is insulin-dependent diabetes or juvenile onset diabetes or type 1 diabetes happens in 5 to 10% of diabetic persons, and autoimmune markers are usually present. Pediatric diabetes is usually a diagnostic challenge. With childhood obesity, those are the obese in the white circle, and type 1 diabetes are mostly not obese, while type 2 children or youth with diabetes are mostly obese, and the monogenic diabetes, around 50% of them are obese, and diabetes with syndrome, around 50% of them are usually obese. So this is a pediatric challenge, how to diagnose diabetes in juvenile persons or infants or pediatrics. Type 2 diabetes in the youth, before 1990, only 5% of children or adolescents diagnosed with type 2 diabetes are classified as type 2. Type 2 was not diagnosed commonly in children or youth in the era before 1990. Now it accounts for 30 to 50% of diabetes in children or youth. They are type 2 diabetic persons. The national data estimate tripling the rate of overweight and adolescent during the past 20 years, and it is considered number one consequence of epidemic of obesity in children, type 2 diabetes. And again, the American Diabetes Association put some recommendation for screening of type 2 diabetes in children and adolescents based on overweight or obese children, more than 85 percentile, having a history of type 2 diabetes in the family, obese person, physical inactivity, some ethnic backgrounds, and signs of insulin resistance like acanthosis nigricans, dyslipidemia, polycystic ovary syndrome. And number 3 in classification, the third type of diabetes is gestational diabetes, which occur in 3 to 10% of all pregnancies, and it is due to placental hormones during the mid-trimester, causing insulin resistance, and these hormones are cortisol, progesterone, human placental, lactogen, prolactin, and estradiol. And those are the risk factors when to screen for type 2 diabetes in persons with previous when to screen for gestational diabetes in persons with previous gestational diabetes, in persons with overweight and obesity, in higher maternal age above the age of 35, and in those with family history of type 2 diabetes. Cystic fibrosis diabetes-related diabetes is the most common comorbidity in people with cystic fibrosis. It is diabetes, and it is associated with worse nutritional state and severe inflammatory lung disease. The last type is a monogenic diabetes, and it is a monogenic defect of the beta cell, causing beta cell dysfunction, neonatal diabetes, and MODY, occurring in 0.5% of diabetes. And those are some characteristics. The onset is before the age of 25, and there is impaired insulin secretion and minimal defect in insulin action. And those are the most common types of monogenic defects, and the most important in these, that some of these types are treated by sulfonylurea, and we don't need insulin at the beginning. At the end, let's talk about the IGF. The IGF says that people with diabetes should have the chance of coverage of insulin, coverage of anti-diabetic medication, of glucometers. We should support our diabetic persons, and let's hope for the coming news in the beginning of December in IGF in Busan, December 2019, to finish the news of diabetes 2019. Thank you.